But let's say someone does need surgery. So tell us why a patient would need therapy both before an operation and after an operation.
So my prehabilitation approach is very unique. It is a clear-cut approach that identifies the shoulder joint, or say they're getting a knee replacement, and I look at those imbalances. I will fix the imbalances prior to surgery because, let's face it, for a knee replacement, the doctor's really going in and just cutting the bone. They're doing a great job at fixing the bad arthritis.
Right.
But I'm actually going in and fixing the muscle imbalance before they go in for the surgery. I have a lot of anecdotal data that if you do prehabilitation, your post-op rehab is a breeze. Most people obviously do need rehab after surgery.
Of course.
We've got to control the swelling. We've got to control the pain. This is really important. So I focus a lot of that immediately post-operatively and get them back to walking.
Now, I really definitely want to talk about your practice, Premier Therapy Solutions. You have a medical concierge program. That already sounds fancy, and I love it. So tell me a little bit about this program and how important is it to provide this to your patients?
So I started the medical concierge program with one patient who had had a back surgery and they had operated on the wrong level. Oof. And she had a lot of issues post-operatively. So I created this program which basically examines your entire medical history from beginning to end. I put it together in a nice brief summary timeline, and then we help to try to find the right physicians of who you need. Might be a urologist, it might possibly be a cardiologist, or you need an orthopedic surgeon for your knee replacement. Right. Then I get them to the proper surgeon. I go with you to the appointment, ask the proper questions. Most of these patients don't know the clinical questions to ask, or they forget.
Or they're overwhelmed.
They're overwhelmed, they can't take notes. What do I need to take? Then you start dealing with polypharmacy. A lot of doctors are talking and they're not speaking to the other physicians, and everybody's prescribing different medications. A lot of the polypharmacy can lead to falls. Falls among the elderly is a big problem. Mm-hmm. Balance issues, they fall and break a hip. So this concierge program, I speak to all the physicians, we collaborate, and then I even go into the operating room with you.